I'm doing a persuasive presentation for Liberty University. I'm Gloria Levandowski. We're going to talk about early screening. It was in the 1990s. I was in my early 40s. I went and had a pap smear on a whim. I get a call about a week later from the nurse's office saying, "You have precancerous cells." My life did flash before my eyes. She said to come in as soon as possible. You hear the big C word. You know what? If I hadn't taken action, I wouldn't be here today telling you about early screening. In the winter of 2010 and 11, I get a call that my older sister has died of colon cancer. I didn't even know she was sick. She was a very private person, and her husband had been taking care of each other and hid this illness from everyone, and only calling hospice the last week or two of her life. After she died of colon cancer, I was encouraged to go have a colonoscopy. They found precancerous polyps. My testing saved my life. We're going to talk about 3 cancers today: cervical, breast, and colon. What do you do to prevent having full-blown cancer? Early detection and knowing the risk. Let's talk about cervical cancer. Pre-screening and having those yearly exams can find you for risk of precancerous cells. Your doctor can remove them before they've developed into a tumor. Another risk is your age. If you're over 40, you've been on birth control for over 5 years or more, or maybe you've been on a drug that's lowered your immune system. But the #1 risk factor for cervical cancer is HPV, human papilloma virus. This is found in most of our bodies and we don't even realize it. But having those yearly exams, your doctor can determine if you have this virus. He can remove those precancerous cells like he did with me. And therefore, your survival rate has increased. Let's talk about breast cancer. Early screening and yearly breast exams by your physician. And mammograms. Mammograms are for screening and diagnosis. Your physician can feel for lumps. Your mammogram can detect different sizes. The smallest one here can be determined by your mammogram. If you let it go, the lumps can be this size. Therefore, treatment is almost impossible for recovery. Colon cancer. A lot of times this is only detected when you have a family member and your risks are improved and you go in and have a colonoscopy. Well, you know, when we have precancerous cells and we have yearly exams, this can save our life. When we have yearly breast exams and we're screened, this can save our lives when the lumps are found small. You know, cancer is the #1 cancer in women besides skin cancer. 192,000 women are diagnosed with breast cancer a year. Women should be their own advocate. Notice any changes in their body, any symptoms they have, and go to their doctor for their yearly screening. Colon cancer. Sometimes we wait until we're over 50, but knowing that a family member has had it, we know that we're in risk. What is the truth about colon cancer? It's a second leading cancer killer. It's found in both men and women. Often it starts with no symptoms at all, only if you know that another family member has had cancer. You can stop this cancer before it starts. When you find a lump in your breast, what do? I had a sister who went to the doctor and she found a lump in her breast, but she was a caregiver for her husband who had Parkinson's disease. She was in denial and for 10 years did not know treatment and told no one. It was her hidden secret. 10 years later, she was in so much pain she went in for surgery. She was full of cancer. She never regained consciousness. So what do? Take action. You can be your own advocate. You can have those yearly exams. You can see your doctor and take action and screening for life. You have family members that care about you. Your life is important to them. If you don't have a physician, find one. If you don't have good insurance, there are ways and organizations that can help you. The American Cancer Institute, especially in Wyoming, I know, has programs to help you get free colonoscopies if you qualify. Maybe you've been diagnosed with cervical or breast cancer. There are foundations that can help in the cost and the recovery. You can be your own advocate. You can prevent breast and cervical and colon cancer from taking over your life. Get screened. If you haven't done it, do it today for those that you love and they love you. Thank you all.